Well, heart disease, it is the #1 killer of women in America. In fact, it actually affects more women than breast cancer. The good news is that heart disease is largely preventable. Dr. Laurie Steelsmith is a naturopathic physician and practitioner of Chinese medicine, trained right here at Bastyr University. It's great to have you here this morning. She's also the author of the newly released book called Natural Choices for Women's Health. And we're going to be talking about that this morning. Natural choices versus prescribed medicine. So first off, let's just start with this concept, because some people may not buy into a concept that you shouldn't use any prescribed medicines. Is that your philosophy or not?
Well, there's a time and place for pharmaceuticals, but there's so much that we can do to prevent heart disease on our own.
And we're going to be talking about those natural things that we can do. First off, let's talk about the physical heart, because you talk about the physical heart and the emotional heart in your book.
I do, because they are intimately connected. We all know that stress can impact our heart.
Oh, yeah.
In Chinese medicine, the spirit resides in the heart, so it's very important that we take care of our body, our mind, and the spirit, which is all part of the paradigm of naturopathic medicine.
How do you differentiate between the physical and the emotional heart? What's the difference?
Well, I think that our physical heart is, our actual heart itself with the blood vessels and the electrical system, and then our emotional heart is really our spirit, and it's our nervous system.
So let's talk about what you brought. You brought some things here on the table.
I did.
I smell, I think, what is this, lavender? It smells wonderful.
This
ginger.
is lavender.
So let's start here with some things that we can do.
Now this here is our oat straw tea. And this oat straw tea is actually very nourishing to the nervous system, and it's very calming. For people who are trying to stop smoking, for instance, which is very important for the heart, you can actually make a tea out of this. And
it doesn't look very appetizing, but it smells divine.
I know.
The aroma is wonderful.
It's actually very nourishing to the heart, and you can just boil it up with a few cups of water, and you can add a little mint to it if you'd like to give it a little bit of extra flavor, and it's wonderful.
And what is this?
These here are oat groats instead of just oatmeal. Now, oatmeal can also help the heart. It can help to lower cholesterol. And it's the oat fiber that helps to lower the cholesterol. The oat
This is not processed, obviously.
Obviously not.
That's where all the nutrients are.
That's right.
The product that's not processed.
The whole oat, the whole food.
And what does that do again?
That also helps to lower cholesterol, and it helps to nourish the nervous system, which helps to nourish the heart.
I love cayenne pepper. One of the first things I actually recognize here on the table. What is that for?
Well, cayenne increases our circulation, also helps to lower cholesterol. It kind of warms the body, and it's great to add to your dishes, to your Indian dishes, to your spicy Mexican foods. And, these are all foods which are just so wonderful for us.
But you can really add to all kinds of things. Let's talk about the emotional heart now and some of the things that could benefit our emotional well-being.
Sure. Well, lavender can nourish the heart. It's very calming.
It is calming. Is it just because it smells so wonderful?
It's because it smells so wonderful. It also has an effect on the limbic system. So aromatherapy actually has a profound effect on the brain and the emotional center of the brain. So for people who are feeling emotionally stressed or distressed, they can take an aromatherapy bath. They can rub the lavender on.
I'm already there.
Yeah, great.
Should we worry about any of these natural ingredients and how they interact with medicines if we're taking some?
Well, because these things here are all natural foods except for the lavender, but the lavender can be made into a tea, there's really no interaction.
Okay, so it's all good. She's not going away. Actually, we're going to have you back in our next hour to talk more about women's health. You're going to be focusing on what exactly?
We're going to be focusing on PMS, perimenopause, and menopause, and how we can use natural medicine to make this transition to life.
There. That's coming up in our next hour. Thanks so much. And again, the name of her book is Natural Choices for Women's Health. Thanks so much, Dr. Steelsmith. See you in about an hour.
Thank you, Fred.
Thank you.